Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah rabbil alamin. Wassalatu wassalamu ala asyrafil anbiya wal mursalin wa ala alihi washabihi ajma'in. Allahumma salli ala Muhammad wa ala alihi washabihi ajma'in. A very good day to Dr. Naafida Ismail and all my fellow classmates. So today our group consists of me, Muhammad Azhar Shahril, Nawal Alia and Nur Shafiqah will be discussing about a recent event that happened nearly just 2 years ago, but its effect are still mingling around us up until this day, which is the relation between COVID-19 pandemic and the Malaysia political economy. So to start up, it is clear that COVID-19, or also known as novel coronavirus 2019, has disrupted nearly every countries in the world, regardless of poor, middle, and developed countries, and also has disrupted nearly all economic sectors that existed around the world, from small, medium enterprise up until big and mega multinational companies that existed. As I mentioned, every country has been hit hard by the COVID-19 pandemic, and Malaysia is not exempted from affected hard by the pandemic. Our government has implemented a major lockdown called Movement Control Order effectively on 18 March 2020, which its main objective is to control and lessen the risk of COVID-19 from entering our countries. But because of the movement control order, our citizens need to pay the utmost price, where many people lose their jobs, many the closure of education sectors such as school and university, and also the closure of public health worship, which is totally disrupt our social economy and social sectors. Not to mention that people who are rely upon uh, the people's movement, which is tourism, hospitality, and aviation sector, also need to pay a huge price, where their bosses need to lay down most of their employees because they couldn't pay up the salary of their people. And this is the time that Malaysia faced this kind of event since independent in 1957, where our country never never been handled this kind of unprecedented health crisis. And also our country has never been hit by the pandemic. Not to mention that only our country, but also every country, as I mentioned, has been hit hard by the pandemics. And the public health sector would be the major sector that affected the most by the pandemic, since there are be some cases that our healthcare facility has been on the brink of the collapse, where the large number of COVID-19 cases, limitation of medical supply, and also the manpower has become a huge factor on why our public health sector in the major on the brink of the collapse. And also the economy in Malaysia has nearly reached an all-time recession, where the last time Malaysia has faced such a financial crisis during the era of Dr. Mahathir, which is the 1997 Asia financial crisis. But at that time, only the sum of Southeast Asian and South Korea has been affected by this unprecedented financial crisis. But the COVID-19 recession, also known as the Great Lockdown, has affected nearly every countries that existed around the world. So for the research question, based on the problem statement that I mentioned before, our research question will be categorized into 5 different kinds, which is, first of all, why COVID-19 impacts Malaysia economy? How does the coronavirus outbreak affect Malaysia country economy? How Malaysia's government address this kind of economic effects? What are the challenges the Malaysia government face by tackling these effects? And last, what what is the Malaysian government could learn from the management of these economic implications? So our research objective will be to investigate the impacts of coronavirus 2019 over the Malaysia economy, to identify the example of the coronavirus impact to the Malaysia economy, to evaluate Malaysia's government in address the impact of COVID-19, to analyze the challenge that Malaysia's government faces while tackling the impact of COVID-19, and to recognize Malaysia government evacuation from managing the Malaysia's economy during the COVID-19 recession, meaning that the main theme of our research would be the the impact of COVID-19 and its relation on how it changed our political, economy, and also the social life of the Malaysian society before and after the pandemic. arrived in our countries. So the first research objective would be the relation between COVID-19 and the Malaysia economy. As previously stated, the novel coronavirus 2019 or COVID-19 is a new virus, and most public health experts did not have any exact idea on how to curb the spread of virus, none other than implementing a strict lockdown to minimize the movement of the people. So government at that time, Prime Minister Muhyiddin Yassin has implemented a strict lockdown called Movement Control Order, where this kind of movement restriction prohibited people from going outside or even going traveling from one district to another, and implementing several strict SOPs such as limitation of people entering the essential markets or wet market, prohibition for people entering the restaurant or dine in, and even the closure of educational institutions such as school and universities. This kind of SOP and strict lockdown has affected the economy of B40 and M40 income class the most, where this kind of implementation that limited people movement will affected several industry that rely upon the movement of people. The best example would be the tourism and hospitality sectors, where if the people cannot even get out of from their house, then the hospitality sectors will not have their source of income, and if they did not have the source of income, then they didn't have a choice but to laid up some of their workers, especially those who are working in the hotel or maybe homestay sector such as front desk or maybe cleaners, because the owner did not have enough money to pay up their salaries. And also the example that we can say from the strict SOP would be the bazaar and markets that complicate people's daily life, where because when we see from the pre-pandemic, people do not have to wear masks or even uh, having social distancing 1 meter from the another. They can just enter their premises without even scanning the MySejahtera. But after the arrival of COVID-19, the economy sector need to follow this kind of strict guideline, where they need to prepare MySejahtera QR code. They need to socially distance their customers, or even make a mass mandate, where this kind of approach affected both consumer and businesses owner, where the businesses need to enforce this kind of strict law, or else they will be sued by the government. And also the consumer need to follow this kind of strict SOP made by the government, or else they also will be sued by the government for not following the Act 324, Prevention of Infectious Disease Act. And also, as I mentioned before, Malaysia is depending well on entry of tourists, as lot of tourist attraction are available here, where we can see that the Pulau Langkawi, Terengganu, and also Sabah and Sarawak are rich with the tourist attraction. And if the and when the government prohibit the entry of international tourism in our country because of the issue of the pandemic, this is of course will cause for the loss of income for this industry player, as lots of homestay and hotel need to close down because of the large loss, where we can see that several major hotel from small up until the big hotel need to close them their premises, simply because their source of income has lost because of this strict measure. So we can see that the relation between COVID-19 and Malaysia economy is that positively, the strict measurement made by Prime Minister Muhyiddin has somehow eased the burden of our public health sector, as they can use those kind of restriction to ease the number of bed or ventilators to treat the both COVID and non-COVID patient. But negatively, the industry player that heavily rely on the movement of people has affected the most, simply because their source of income has greatly affected, and they need to survive on the other way, or else they will lose their main source of incomes. The second objective would be the impact of COVID-19 to Malaysia's economy. As mentioned before, the relation between COVID-19 and Malaysia economy would be the implementation of strict lockdown called Movement Control Order made by Prime Minister Muhyiddin Yassin. COVID-19 outbreak and the implementation of MCO has changed the daily interaction and norms of Malaysia's daily activities. For example, whenever a person is buying their groceries without wearing any face mask or scan the MySejahtera QR code, that person will receive a unpleasant stare from the public simply because they didn't follow the new norms made by the government. That's how powerful the implementation of strict SOPs and lockdown has changed the norm in our countries. The implementation of MCO also lead to the rising number of unemployment rate simply because many companies cannot afford to pay their workers. For example, because of the implementation of a stay-at-home order and remote working environment, many private and public sectors have taken an initiative on eliminating several non-essential positions that did not happen to majorly affected their companies. So they took the initiative on fire some of these position in order to save up the financial status of that particular companies. Sectors like tourism, e-hailing, and entertainment sectors has been affected the most simply because the number of people interaction has been reduced greatly because of the movement control order. For example, e-hailing workers can generate a huge amount of money during the post pre-pandemic era because of the domestic and international travelers can want to explore our countries. But after the arrival of COVID-19 and implementation of MCO and the restriction of the international traveler, e-hailing workers cannot even generate the income that can provide their capital because there is a very small number of people using their services, and even though there are some workers, essential workers that using this kind of e-hailing service, it is still not enough to compare the numbers to the old days where they generate a huge amount of revenue during the pre-pandemic eras. And the pandemic also lead to the shortage of essential that leads to panic buying. Some people they having a dilemma on the uncertainty on when the pandemic will end and the restriction will be lifted. So they took initiative on uh, buying as many essential resources as they could and stock in their house. This might be good to that person only, but to the person that cannot did not have the opportunity to buy, this surely will affect their daily livelihood as they cannot have any groceries that they could buy because of the insufficient stocks. And lastly, the impact of COVID-19 would be the usage of online platform for small and medium enterprise SMEs. Since many Malaysians are implementing the stay-at-home order, they use the internet nearly every day in their life. So the SMEs need to utilize this opportunity to learn and use the online platform for marketing their business as many Malaysian, including the consumer and the business and the SMEs industry player cannot go out. So both of them can interact in each other in the online marketing platform, and it is an easy way where the customer can just simply tap on their smartphone and interact with the sellers without need to go out and risk themselves to getting the viruses.
Hi, my name is Najafika Muhammad Bakri, and now I will continue this presentation by explaining about the third research question. So, the third research question is how Malaysian government addressed this economic effect. Since the COVID-19 pandemic hit Malaysia in early 2020, the Malaysian government has taken various measures to overcome the economic downturn that caused by this pandemic. The first strategy introduced for the government is introducing a 20 billion financial stimulus package to reduce the impact of COVID-19 on the country's economy. The stimulus package was announced in February 2020 by the Prime Minister of Malaysia at that time, Tun Dr. Mahathir Mohamad, and it was the first economic aid announced in Malaysia was hit by this COVID-19 pandemic. The stimulus package strategy is aimed at helping individuals affected by this pandemic, facilitating cash flow and stimulating the tourism sector. The action taken by the government to reduce the economic burden to uh, due to COVID-19 and to stimulate the tourism sector is by providing reduction in electricity bills and also tax to tourism company, airline and other companies that are involved in the tourism sector, and provide one-off payment 600 ringgit to tourist guide, to taxi driver, tourist bus driver and registered rickshaw drivers. In addition, through this strategy, the government has reduced the EPF monthly deduction from 11% to 7%, provided 100 to ringgit to household, and also 40 million has been allocated to assist SME in agriculture and food production. Lastly, to encourage quality investment through this strategy, the government has exempted import duty and sales tax for 3 years for any purchase of equipment and machinery for port operation. Okay, now we're going to the second step. The second strategy taken by the government to reduce the impact of COVID-19 on the economy is by introducing Prihatin Economic Stimulus Package. This economic package was introduced in March 2020 and a total of RM 250 million has been allocated for this Prihatin Economic Package. Among the initiatives provided by the government through the this Prihatin package is an allocation of 126 billion for cash payment and a moratorium on loans to low-income household that affected during the period of the MCO, and also 101 billion has also been allocated for the small and business medium-scale enterprise, where various assistance such as wage subsidy, loan and SME financing are provided to assist these small and medium entrepreneurs. The last initiative that government took through the Prihatin package is the allocation of 3 billion ringgit to strengthen the country's economy through the empowerment of investment and foreign trade. The next step taken by the government is by introducing a short-term economic recovery plan, which is Penjana. The Penjana package introduced in June 2020 aims to support the economy to be able to operate in the new normal. Through the Penjana package, the government has undertaken various initiatives, including the introduction of tax incentive for foreign companies in the manufacturing sector to locate their businesses in Malaysia, to attract foreign investors, the establishment of the National Generator Fund to accelerate and facilitate digitization efforts in the business sector in Malaysia, and introducing technology innovation sandbox to encourage creativity and innovation. Okay, now the next strategy taken by the government to stimulate the Malaysian economy is introducing the Pelindungan Ekonomi Rakyat Malaysia Permai Assistance Package with an allocation of 15 billion. Through this Permai package, the government has implemented several initiatives to achieve this package objective. Among them is introducing the food basket program, continuing the moratorium and reducing loan installment by financial institution, and extending 1 GB of free internet data to the pupil. Other initiative is expanding the 3.0 salary subsidy program, which can benefit all the employers that affected by the MCO, expanding Prihatin Plus special grant for small and medium entrepreneurs, and give one-off payment that worth 500 ringgit for tourism sector employees, including tourist guides and taxi drivers. Lastly, to overcome the economic impact of the COVID-19, the Malaysian government has also allocated a fund of RM20 billion for the success of the Pupil and Economic Strategy Empowerment Program. Pemerkasa. Among the initiatives implemented under this Pemerkasa program were the provision of salary incentive, tax incentive, and micro credit financing facilities for the affected sectors, as well as the immediate implementation of the development projects. Apart from that, the Small Medium Enterprise Corporation also provided a fund of 15 million ringgit to help local and small and medium enterprise, and the government also provide grants worth RM 13 million to encourage palm oil investment. Now I will explaining about the fourth research question. What is the challenge Malaysia government face while combating this effect? I will categorize this challenge into three aspects: political, health, and economic aspect. Firstly, the challenge from the political aspect. Since the beginning of the COVID-19 outbreak, which is in early 2020, Malaysia has been hit by a political crisis that has caused concern to various parties, including the people themselves. The power struggle and political squabbles that took place in the Malaysian administration at that time made it even more difficult to deal with the COVID-19. According to a report from the Berita Harian newspaper, Heard Aspect and so NGOs have the opinion, they said that this ongoing political crisis will further complicate efforts to deal with COVID-19 and could cause the death toll to increase. Apart from that, another challenge faced by the Malaysian government to address the effect of COVID-19 is the lack of cooperation and support from the people. The ongoing political turmoil at the time of the COVID-19 pandemic had caused dissatisfaction among the people, and the people also began to revolt. The people's trust in the government also began to decline because the government was considered not to care about the welfare of the people. As a result of that, the people no longer show support and cooperation to the action taken by the government in addressing the effects of COVID-19. Next is the challenge from the health aspect. From this aspect, the emergence of the dangerous new COVID-19 variants from time to time has hampered the government's effort to revive the country's economy. Since the transmission of COVID-19 began in Malaysia in early February 2020, Malaysia has faced a wave of various variants with higher infection rates, such as the Delta variant and the Omicron variant. The emergence of new and more dangerous variant has forced the government to slow down the economic recovery process to reduce the spread of these variants. The last one is the challenge from the economic aspect. From this aspect, the failure of the Malaysian government to manage foreign workers has led to the negative impact on the survival of industry and business in Malaysia. The researchers state that Malaysia did little to protect these foreign workers from the effect of COVID-19. Thousands of foreign workers were reported to have lost their job, and some were not paid during this pandemic. As we know, foreign workers are one of the important pillars of the Malaysian economy because they mostly work in important sectors such as the construction sectors. Therefore, the failure of the Malaysian government to manage foreign workers will affect the industry in Malaysia, and it will also be one of the challenges for Malaysia to revive the country's economy. Okay, that's all from me. Now I will pass this presentation to the next presenter. Thank you.
Assalamualaikum and hi everyone. My name is Nawa Alia. Right now, I will talk about the lessons for Malaysia's government from the management of economic implications during COVID-19. So there are several lessons that Malaysia's government could learn from the management of economic implications during COVID-19. The lessons are divided into three main aspects, which are first, the economy, second is health, and third is politics. Firstly is economic. The government of Malaysia must be better prepared in handling food security issues. The COVID-19 epidemic has raised concern about food security in Asia and the Pacific. Food accessibility and availability have been disrupted by domestic and international food supply networks caused by increased health hazards and significant travel restrictions. Domestically, upstream food supply chain interruptions have resulted from mobility constraints and worker diseases during planting and harvesting and hampered operations in processing, trucking, logistics and trading. Loss of jobs and income reduces food intake, putting this disadvantaged group in danger. Border closures and export restrictions on a global scale could result in limited availability and affordability of particular food goods for countries that rely on imports. According to Rahman and Martin, roughly 75% of people in urban slums had less income than 63% of persons in rural regions. This situation had resulted in 28% decrease in food spending for a household in urban slums and a 23% decreases in rural areas. Among people who live in urban slums and rural areas, 24% of households with 3 meals a day have cut back on their food spending. This affects their food safety. These families have also cut back on how much they eat by about 47% in urban slums and 32% in rural slums, which means they eat less food. One of the suggestions to overcome the food security issues, the government aimed for a high crop yield. The government should select a crop that yields the most kilograms per hectare per year. Malaysia's research and development efforts must be stepped up to develop new varieties capable of increasing a paddy output per hectare. Mardi currently produces 52 types of paddies cultivated in all granary areas. In comparison, India has created over 1,500 types, while the Philippines has produced over 100 varieties of paddy. Thus, farmers now have a broader selection of paddy seed ideal for their acreage and local climate. Secondly, the government needs to adopt the digital economy to lessen the economic impact of unexpected lockdowns. The commencement of the COVID-19 pandemic and the implementation of the Movement Control Order, the MCO, in Malaysia has caused an extraordinary drop in economic activity. In the second quarter of 2020, Malaysia's GDP fell by a record-breaking 17.1%. Businesses embraced digital strategies to compensate for a decline in traditional revenue sources. Firms left out of the digital revolution will struggle to exist, let alone grow, as more businesses go digital. In Malaysia, 99% of businesses are small and medium enterprises, and 6.62 million people were working for SMEs in Malaysia in 2018. That is 38.3% of the country's GDP. Thirdly, the government needs to set up a better social protection for everyone. Concerns have been expressed concerning the sufficiency of social security, notability, retirement savings for informal sector employees in the middle of the COVID-19 outbreak and its economic consequences. The Employees Provident Fund, EPF retirement scheme and the cash transfer program Bantuan Sara Hidup for individuals earning 4,000 or less are two existing social safety initiatives that help non-public sector workers save for retirement. Despite this, the World Bank newest findings for Malaysia indicate that savings are now among the B40 low-income category and women based on data from the EPF contributors. A proactive approach is required to ensure long-term social protection for the citizens, especially the most vulnerable populations, notwithstanding the government's effort to meet public needs through the initiative that they offer. Creating a national social protection and policy is the first step in ensuring that everyone in Malaysia has social protections. A single national coordinated council comprising the vital ministries must be constituted to accomplish this. In addition, particular emphasis should be placed on increasing retirement savings as they are among the most important social safety nets for the long run. Notably, 39.2% of the workforce has no contribution to their retirement, and low-income workers have no savings because of their low payments. The second aspect is health. The ability of a country's healthcare system to cope with any outbreak, especially one as severe as COVID-19, is critical. The government must ensure that the healthcare system must be appropriately managed. The entire healthcare system may become overburdened due to ineffective management and administration. Since the beginning, the Malaysia Ministry of Health, the MOH, has been planning for the worst. In times of crisis, teamwork between the public and private sector healthcare is critical, and neither sector should be allowed to operate in isolation. For example, the collaboration between public and private labs to run COVID tests. Initially, most tests were conducted in government laboratories, which were equipped with to handle daily demand for testing. Private hospitals and laboratories have increasingly opened their doors to share the burden and dependence on state laboratories. Healthcare workers' adequacy of personal protective equipment (PPE) is another lesson the government could learn from this pandemic. The MOH worked tirelessly to obtain enough PPE for all healthcare workers involved in COVID-19 management. In times of crisis, PPE is a valuable asset that has been hoarded by some, resulting in massive demand and insufficient supply for others. In some countries, a lack of PPE has resulted in COVID-19 infections and death among healthcare workers. Lastly, the well-being of healthcare workers. People who work in healthcare are critical to fight against this virus. They are a part of public healthcare system and work to keep the citizens healthy. They are the people who put their safety and health at risk and are in charge of COVID-19 related activities. The MOH deploys more healthcare staff from fewer COVID-19 cases to several red zone districts. Besides, MOH has also asked private and retired medical personnel to help oversee COVID-19 around the country. This is an excellent lesson for the government to reflect their contribution to the healthcare system for the future pandemic. Lastly, from political aspect, good governance is vital in ensuring a smooth administration in times of crisis. The key characteristics of good governance are accountability, transparency, responsiveness, efficiency, following the rule of law, and many more. Firstly, consensus-oriented is vital to have good governance. Good governance necessitates the mediation of society's diverse interests to create a broad consensus on what is in the best interest of the entire community and how this might be accomplished. Additionally, it requires a broad and long-term perspective on what is required for sustainable human growth and how such development might be accomplished. During a time of crisis, such as during the COVID-19, Malaysia's government must be able to cater the needs and interests of the majority of the people to ensure their well-being. Secondly, it is about transparency. Transparency implies that choices are made and enforced by laws and regulation. Additionally, it implies information is publicly accessible and directly accessible to individuals whose such decisions and the implementation may impact. It also implies that sufficient information is presented in easily understandable formats and medium. This pandemic has demanded the government be more transparent in their data about the current cases to inform the public on the actual situation on the ground. To do that, they need to deliver understandable data for all public. Lastly, effective governance requires that procedures and institutions create outcomes that suit society's needs while maximizing resources. Efficiency in good governance includes efficient resources usage and environmental protection. This pandemic has proven that the government must maximize available resources to prevent more fatalities, especially in healthcare. To summarize, the most impacted aspect in COVID-19 is economics. Economic well-being determines many aspects such as the well-being of people, the healthcare system, political stability, and many more. We can learn several takeaways from this topic about the COVID-19 impacts on Malaysia's economy. Firstly, the government must be prepared financially to revive the post-pandemic economy. The recovery must consider all sectors in economies as every economy was hit hard by the pandemic. The government's proposed solution must be a long-term solution and must consider a future pandemic. Besides, the government and Malaysia must adapt to the new norm of post-pandemic economic activities. This must be done according to science-based regulations to curb the pandemic by implying the standard operating procedure based on the recommendations from the World Health Organizations. Secondly, the government must build stable politics to ensure smooth administration to have a better economic outcome. Good governance is the key to handling this pandemic. They must ensure transparency, efficiency, and responsiveness to win against this pandemic. In addition, the people must cooperate with the government by complying with the standard operating procedure. This is the primary key to curbing COVID-19 as this virus can be spread easily. Lastly, to ensure the well-being of human capital as they are the assets to the economy. The well-being of humans can be included from the health aspect and economic aspect. To achieve the optimal result in the economy, humans' well-being comes first. This pandemic has shattered human well-being due to extended lockdowns, increased unemployment, and a rise in mental health and physical health issues. This pandemic proves that human well-being is essential to ensure continuity in the economy. Without good health, everything will be collapsed. That's all from us. Thank you.